Today she is going to one of the villages, where she is going to see some women. She will be there the whole day. She puts on a sari as usual, and short-sleeve blouse with her umbrella. Unfortunately, there is no vehicle this morning at the bus stop from where she takes rickshaws to go to villages. Good that this village is nearby, and she can walk, but it is hot. After waiting for 30 min, she starts walking. The sun was getting up, and she started sweating within few mins of walking. After an hour of walking she reached the house in that village. Some women were already there, and they greet her. It is the biggest house in the village, and the house of a member of village governing committee. The lady of the house named Kaberi usually takes pride in hosting these kinds of events in her house. Kaberi is of 45 years of age, but very fair, little fat as usual, a typical Indian middle-aged women are. She arranges this in her inner part of house, where usually men don't go, so that they have privacy, if needed. Women who come here usually are open to each other, and they know each other very well. Kaberi Jai arranges it such a way that women are not ashamed of opening their private parts in front of Maya and the others. It is a long hallway where women sit on the floor. And there is small stool for Maya where she sits. The patient and all other mostly sits on the floor. There is a small bed at the end of the hallway and Maya uses that sometimes if needed. Today, there are 4 women sitting when Maya arrived, including Kaberi Jai. Maya came almost after 2 weeks in this villages, and thus she knew today will be a long day. Maya sits on the stool in front of the 4 women. They all exchange greeting with Maya. Kaberi Jai brings a towel for Maya which she uses to dry up her sweat. Maya takes out her BP meter, stethoscope, thermometer, and blue box containing the syringe and needles, alcohol and cottons, and kept those on the lower stool in front of her. At that point, Kaberi Jai called her maid, Ganga, who brings boiling water on a pot, and put that beside Maya. Couple of other women also arrive, and they will keep coming the whole day. Sometime there will be no one. Maya will have lunch in between at Kaberi Jai's house. Kaberi Jai insists all of that, although Maya did not want initially, but she now agrees as this is village hospitality. Maya then says who will come first. There is no line of anything, they just make it more friendly, and work within themselves to get checked and get medicine. Kaberi Jai says, Roji is newly-wedded bride of our village, and she is here today, and she can go first. A woman named Roji comes forward, and sits on the floor on the right of Maya. Maya, after greeting with her, starts to ask questions, and prepares her BP meter to put on Roji's arm. Roji is wearing a sari and a tight blouse. Roji lifts her palu from the left arm, and then waits for Maya to put the BP calf on her arm. Then Maya says, take off the blouse. Maya like to do that she can easily measure on top of blouse, but she like to undress the blouse of the patients even for BP measurement. She feels that this makes the new patient little embarrassed, and they usually listen to what she says afterwards. Also, that is needed to make them comfortable of talking their personal matters in front of other women. Roji is hesitant as everyone can see that, but then Maya says, no shame in front of doctor and we all are ladies here. With hesitancy, Roji takes off her blouse. To note, there was no bra or underwear concept in the villages at that time. So after taking off the blouse, Roji was exposing her boobs as well, so she tries to cover those with the sari, and expose her left arm to all. Roji is 21, and she is not fat at all. In fact, she is quite good looking, and her figure is perfect. When she exposes her arm, Maya likes it. This is perfect. Roji has only one big vaccination scar from smallpox vaccine, just like Sri Devi Jai, on her left arm, but also a small scar from BCG on top of that. Maya holds Roji's arm and puts the BP meter and tightens it. She puts the stethoscope on her ear and starts pumping. She intentionally goes too high at about 220 on the dial to see if Roji gives any reaction as the bell puts much high pressure to her arm. Roji closes her eyes with little pain in arm from the belt. Maya then let go the valve, and pressure starts to drop on the dial. After a few moments Maya takes out the BP calf from Roji's arm. Then Maya takes the thermometer from the stool in front and holds Roji's arm, and put the thermometer at the armpit of Roji. Roji gets a little embarrassed as there is hair in her armpit. All other women are all looking at Roji.